When we go through our testing, especially the parts where we're looking at your reflexes, the thing that I'm looking for are signs of what I call nerve dysfunction. I want to see how well your brain and your body are communicating. And the reason that's important is because I'm really interested in the health of your brain. Now, when we're doing that kind of testing, some people have the term they call biohacking, right? So they want their bodies to be functioning at their optimum, the highest level they possibly can. And so they're looking at all these different ways that they can monitor the progress, and they'll choose different behaviors in order to help themselves out with that. My job here as your chiropractor is to do a couple things. One is to assess the reality of what got you in this position in the first place. Where are you right now? Where's your baseline? And then it's my job to predict, given a course of care, where could we expect you to be able to get to? I think of this like we're going to go on a road trip. Let's say we're going to drive from Fort Myers to Miami. You'll want to know along the way whether or not we need to stop to use the bathroom, or whether we need to get gas, or if we want to stay someplace to eat. And there'll be signs along the way to tell us if we're getting closer to that. When we do reassessments with people, we're using these initial findings to be able to figure out a goal short term for how we're going to get to our next step. But that even includes during wellness care. So let's say your body has no symptoms or no problems, right? But we're looking at something like your balance. There is a average balance for most people. If they stand on one foot with their eyes closed, that's around 15 seconds. And so there are people who come into the office who are better than that, and there are people who come in the office that are worse than that. Well, my goal for our patients is for you to actually be better than that. And so we may set that up so that we have a goal for you to be able to stand on one foot for 20 seconds on your right and 20 seconds on your left. When you start off standing on 10 seconds on your right and maybe 12 seconds on your left. These are ways that we can look at the progress of your body. There's other things that we look at that has to do with your eyes and how they're talking in with your brain. See, different muscles actually will coordinate different movements of your eyes based off of the parts of your brain they're associated with. And so when we're doing visual reflex testing, what I'm looking at here are ways for me to understand the parts of your brain that are functioning well and the parts that might need a little help. And if there are parts that need a little bit of help, what I can do as a chiropractor is help target that nerve dysfunction through specific chiropractic adjustments. There might also be exercises or activities that we're going to do, both here in the office and at home as well, in order to enhance those neural pathways and help clean up any of that nerve dysfunction. The other thing that we're trying to do is we're trying to help balance out the other aspects of your system. So the neuroskeleton, what I'm going to call the spine and the cranium and all the associated structures there, the nerves that come out, I'm going to call that the neuroskeleton, is one piece where we look for nerve system dysfunction. We can also tell in the tone of muscles. And your muscles can either be a little too tight or not firing enough. So when we're testing your strengths, that's one of the things also that I'm looking for. The third piece that I'm really curious about is fascia. So fascia is the tissue that wraps around all of your muscles. It goes actually into things like your spinal cord, down into your organs. It makes up the majority of our bodies. And we can store things in fascia. This is a really important concept. I have a philosophy that says that when we're going out into the world and we're experiencing things, our bodies hold on to that information. It holds on to that energy. And in the body, we'll retain that in order to evolve ourselves, right? We have these experiences and we're trying to level up all the time. But sometimes it's not the appropriate time to do it. And so we'll store that experience in our fascia until a later time when we can move it. Now, we normally will do this naturally all day, every day by moving our bodies or by breathing. But sometimes we need to do a little extra work. I think this is one of the ways that things like yoga and stretching can work for some people, but there's also fascial release techniques that I'll do here in the office. And so those are the three things that I'm looking for, whether it's for a pregnant mom, a full-grown man, or a baby, are issues of nerve dysfunction in the neuroskeleton. I'm looking for them in the muscles, and I'm looking for them in the fascia. And my job as a chiropractor is to bring balance to all of those aspects in order for people to be firing at their absolute best.